Okay, we are live on Facebook.
Greetings, everyone, on this Wednesday, February 17th. We are here to have the town hall in the city of Pontiac for a subject that many of us are interested in this COVID-19 pandemic year that we faced, and that is an informational session on vaccinations, the availability and accessibility, and what's happening with the protocols for getting the shots in people's arms as we confront this dread disease that has impacted all of our lives in one way or another. Whether we have gotten used to the protocols of wearing masks and the social distancing, whether we've had to help someone who's been ill with the disease, whether we've been infected by somebody whose job we've had to cover because of their having to be quarantined, or whether we have lost someone, and all of us have had that. This has been a tremendously important factor in all of our lives. But now we have the vaccine, thanks to modern science, that is there, that is now available and accessible. So many of you have had questions about how to access that, whether it's safe, whether it's the protocols are, when is your turn? And I do have many distinguished guests who are here to answer those questions and to give you real information about the vaccinations and where we are with that protocol. I am Mayor Deirdre Waterman, City of Pontiac, proud to be a part of this proud city of Pontiac, where we opened our first mass vaccination site at the Robert Bowen Center last Friday. And we're still on the senior part of the protocol, and so many seniors came in there and had their first shot, getting the second shot as part of the Oakland County protocol for getting vaccinations to people in a way that our governor has said that she wants to have as a fair and equitable process in which we're looking a way of taking down the barriers, particularly for people who have trouble with access, the disabled, the homeless, as well as making it a fair and equitable process with distribution that gets shots in arms as quickly as possible. And I have here many people who've been part of that protocol and part of that success story that we've had in getting shots in arms in Oakland County. First, I'd like to introduce to you our very distinguished county executive, Dave Coulter, who I truly call my partner now. We've been a partner in so many different initiatives, this being a very important one. And he has been so essential in making sure that we had accessibility of this and making sure that we had supply that got out to the public as quickly as possible. So we're going to start out as we do the part for our panelists to talk with Dave Coulter, but I'd like to introduce the rest of the panel as well. I'd just like to say, shout out, hey Dave, across over there. Thank you I see you so much and all the things you've done to keep us safe, all the different initiatives you've had, the information getting out there. I certainly appreciate that, and that certainly have provided that leadership here in Pontiac. We also have a representative from the Oakland County Health Department. I'm glad to see I have two colleagues. I still get the chance to try out my old medical hat here and every now and then, although my equipment's in storage. This is a full-time job, keeping the citizens of Pontiac safe and healthy and moving forward with the progress here. But we have both Dr. Russell Faust from the Oakland County Health Department. He is the medical director, and he's going to tell us something about the science of the vaccination and what's going on with that in news. And also from St. Joseph Mercy Hospital, I truly call a partner because they are a part of all these initiatives we have in the city. And we have done previous town halls during this pandemic year about the safety and efficacy and how do people get safe from COVID-19. Very proud to welcome you as well, the CEO and president of St. Joseph Mercy Oakland, and that is Shannon Strebick. Thank you. I miss coming and meeting my colleagues for our staff meetings nowadays, but I'm glad to see you come here to the city of Pontiac to be part of that. And also from the medical staff of St. Joseph, we have Dr. Fabian Frigoli. Thank you for coming, Dr. Frigoli, as well. He is the chief medical officer, which means he is elected and selected by all the medical practitioners at St. Joe to lead them. So you've chosen a good time to lead your fellow practitioners during these trying times, which the medical science has truly come to the forefront in terms of confronting this disease, as well as all the other things you do in such a superior way in terms of the health and public health of the community. And also, Thank you for helping me to put this town hall together, David Bowman, somebody who's well known to the city of Pontiac, uh, a resident himself at times, but he is also the community outreach person, and he's going to talk about the partnership we have. For many of you who've called and said, when is your turn to get a shot? And the fact that there is more demand than there is supply right now, but we have a direct line of communication with St. Joseph Mercy. For those of you who are registering at various sites, we make sure you're also registered at the St. Joseph Mercy site, and he has been calling people directly to make sure they get appointments for the vaccination. So with that as an introduction, I would like to start out with something that we did as a montage, very interesting. I just told everybody that we had the first vaccination site opening at the Bowen Center, our own senior center here in Pontiac. And we have some pictures of a very efficient operation that was carried on there, and people who were getting their stickers after their shot. This is the montage. We're center right now, vaccination site. A lot of people are here to get their first shot.
Okay, I have my shot.
I just got my shot. I got my shot.
And I got my shot.
I just got my shot at the Bowen Center. I got my shot. I'm Dorothy Humphreys, and I've had my shot.
My name, Emilio Gonzalez, and I got my shot.
My name is Irma Gonzalez, and I got my shot.
My name is Dorothy Holloway, and I got my shot.
I got my shot. You come get yours. Okay. Just a little vignette here of people who had come there and gotten their shots. It was such an efficient operation. Dave Coulter, I want to commend your people. We had the ski patrol making sure that people got in from the parking lot safely. People got their information done. They had been pre-registered. And there was just a friendly group of people who got the shots. I was talking to somebody and then I was done. I didn't even realize they had stuck me. So it was a really good testimony to medical science and to your proficiency and to your whole crew in terms of getting these vaccination sites set up. So Dave Coulter, I would like to turn the floor over to you. Can you tell us what is going on in Oakland County in terms of the protocol and how people can access themselves these vaccination appointments?
Yeah, and it's a delight to be with you again, Mayor. Not in person, unfortunately, but I appreciate the partnership that we have with you, and I think you described it exactly right. And the other folks that are on this call. You've got a very esteemed panel of folks that can give you more specifics than I can, but it truly is a partnership, and that's one of the things that we've learned during this pandemic is that it's our healthcare systems, and St. Joe's has just done an amazing job, and they've been an amazing partner as well. Our health department, and Dr. Faust is here. I call him our Dr. Fauci because Dr. Fauci is very well known, but we've got our own Dr. Fauci, and that's Dr. Faust, and he has given me and our health department incredibly good guidance on how do we do this in an equitable and scientific and a fair way. And Mayor, you talked about the equity of it. And I just want to reiterate that is something that we take very seriously here in Oakland County. I applaud and agree with the governor's lens that she looks at when she does the vaccine distributions. And we should start by saying, we don't have enough doses. So I certainly understand the frustration of everyone who hasn't got their shot yet, but we did get 800 people vaccinated, including you, Mayor, and I'm glad you did, because it's important that people see folks like you getting the vaccine, understand that we believe it's a very safe shot, that they shouldn't be afraid of that. And I know Dr. Faust and Dr. Fagioli and others will talk about that. But we got 800 people vaccinated in Pontiac because the downside of the lens that the governor uses is that she looks at the equity by county level. So if you look at the entirety of Oakland County, you discover that we don't rank as high as some other counties in terms of vulnerable population. But we know that within Oakland County, we have communities that are more at risk, Pontiac being one of those. And that's why St. Joe's is such an important partner of ours. So even though the state is looking at it through this fairness lens, we're also adding our own fairness lens in Oakland County to make sure that our most vulnerable communities that may not have the same kind of access or may be more vulnerable given their race, their income, their education, their transportation ability, all these other factors is taken account. And so I was so excited to see the Bowen Center site stood up last week. We'll continue to do those as we do outreach in these vulnerable populations, because I've talked a lot about Oakland Together, and truly the pandemic has tested all of us in terms of our ability to partnership and collaborate. And certainly the city of Pontiac has been a wonderful partner in all of that. Mayor, have you had any side effects at all from your shot so far?
Not whatsoever. Not
Excellent.
yet. How about you? I saw you when you took your shot on Facebook Live, and I said he's brave, so I tried to be just as brave because I thought you did a great job.
You were wonderful. You were wonderful. I haven't had any symptoms, and I want the folks to know that, and especially from folks like you, Mayor, because your residents trust you. Maybe they, even more than they would trust me or Dr. Faust or the county's health department. But I think it's an important message to say that we believe the vaccine is very safe and so critically important to us getting back to the life that we all want to get back to. And I know there's frustration, and I know there's an anxiousness, but I would just tell you that, from my perspective, there is light at the end of the tunnel. The science around the vaccines has been incredible. It does give us hope. And all we need is more doses of vaccines. And I'm also really optimistic. The president's going to be in Michigan tomorrow to tour the Pfizer plant. And he announced just yesterday that they're going to increase the amount of doses given to the states by an extra 2 million a week. That will trickle down to Oakland County. We are seeing the amount of doses that we get gradually go up. And so I know Dr. Faust and others will talk about how you sign up with Oakland County and St. Joe's and all the other places that you can. But I strongly encourage you to do that, because as we get more doses, we quickly turn those around and get them into the arms of folks that need them. And I will tell you that even though, we're still working through that, there's light at the end of the tunnel. And I believe that by early summer, anybody who wants a vaccine in Oakland County will be able to get one. And so we're getting there, folks. And so please be patient. When it's your turn, don't hesitate. It's not 100% painless, but it's a mostly painless process. And it's very easy. And our great staff at Oakland County has made it as pleasant and as organized and as simple as can be. And so take advantage when it's your turn. I highly encourage you to get out and do that and do your part and help Oakland County get through this pandemic.
So yes, one of the questions we frequently get, and my senior specialists are there to take calls from people who have trouble or don't know how to navigate the online portals. And one of the questions they say is, we're seniors, we're part of the protocol. How come we're still waiting? So talk about that. I know you get lots of questions too about the supply right now and what you're doing to maximize the supply. And the fact that even though they're protocols, that they're getting as many shots in the arms as they can. If you talk about a little bit about that too, I think that's one of the questions that frequently occurs.
There's no question that seniors are a priority. They continue to be the most at risk and vulnerable to getting COVID, and they are a priority and have been from the very beginning. But keep in mind two other things. There are other people, essential healthcare workers, frontline healthcare workers, who are also a priority. And we're trying not to say one is more important than the other, but we've got several really important groups. And then a third group that I think we need to talk about, because we're all anxious, I think, to get our kids and grandkids back to school, is that we have prioritized our school workers as well. So we have several high priority groups that we need to get through. And keep in mind, at least as far as the county is concerned, we get somewhere between 5,000 and 7,000 doses a week. That used to be about 2,000. So when you consider that we've got over 1 million people in Oakland County, we can't do this overnight. It will take a few months. We're not talking about weeks, we're talking about months. but we have prioritized our seniors, and we're getting to you as quickly as possible. And you will be called just as soon as we can get enough doses to get them out to you.
All right. Those are good thoughts as we move along and make sure that we're just trying to move along as quickly as you can and getting as much of a supply as we can, because the demand far exceeds the supply. But people who are on the list, who register, that they will be called, right? And that is what your
That's right.
staff is working at. All
That's
right.
right. And frankly, if you live in a vulnerable community, and like I said, we consider Pontiac that's a priority as well, because we want to make sure that we're getting those most at-risk vulnerable people. So I know it's hard to hear, be patient, but I really do believe there's light at the end of this tunnel. We will get through COVID together this year. By the end of this year, as the president said last night, will be a very different scenario than we're in now. And so let's not put at risk all of the sacrifice and hard work that we've done so far. So in the meantime, before you get your shot, keep those masks on, socially distance, stay home when you can. It's still critically important that we reduce the spread. And by the way, we're doing a good job of reducing the spread. We had a huge spike in December. We saw an additional spike after Christmas. But since then, because of all of the hard work and diligence of our residents, our numbers have come down dramatically. And so it's also important that we keep those numbers down as we get through this vaccination period. And so please continue, don't let your guard down, mask up, stay distanced. And I promise you that by this summer, we're going to be in a very different spot than we are today.
Yes. We often rely upon the medical effect of this, but there's been a lot of economic effect for our businesses, for our working people in many ways. So I know you, like I'm concerned about that, and certainly have availed ourselves of the many programs in terms of COVID relief. For example, the money that's now available to restaurants and eateries to be able to have facilities to be able to accommodate people outdoors where they have limited indoors. And also the mortgage and rental relief program that we have that we're in partnership with the county to administer for people who need that. Do you want to comment on anything that's coming up the pike and how well that has been utilized by the county in conjunction with the city to help people? Okay.
Yeah, thanks, Mayor, because as a county, we would not have been able to react the way we did without the CARES funding from the federal government last spring. We have now distributed over $250 million throughout the county with a priority on our small businesses, our restaurants, and individuals. And it has been tremendously helpful, but that money is gone now. And so I know that the president is fighting tooth and nail to get a new package through Congress, and they're fighting over the details now, but I'm optimistic that we will get another round of funding because yes, just because the vaccine is being minimized in our communities, the economic impact is still being felt and will for some time. The unemployment insurance, which is so critical if you've lost your job. And by the way, if you have lost your job and you want to maybe use this opportunity to find something else, a different career, I want to strongly encourage you to either go back to school or get some different training, or go to one of our Michigan Works offices, and we have one right in Pontiac, to look at where other jobs might be that you would have the skills for. This might be the perfect time for you to always do what you wanted to do, but you didn't have the opportunity. So we're looking at all those things. And then the final thing that I would mention that's on our minds is I think there's going to be, we already knew that there was there's increased anxiety and depression and other mental health issues that have just been exacerbated by this pandemic. And one of the things you will see us leaning into over the summer and fall months is making sure that all of our residents have access to the resources around the behavioral and mental health issues that have also surfaced. All of us are stressed. You can be depressed about this. You can have those kinds of challenges. And on top of the economic challenges, I think we're going to have to really lean in on the behavioral and mental health ways that this has affected all of us. And so don't ignore those things. It's not it's not unusual to be feeling those kinds of things. And if you yourself, even now, are feeling like something's not right, just in terms of your own mental health, please reach out. And there's great resources on our website to do that. But don't just put that down to, oh, well, COVID, I'll have to put up with it. These are very serious medical conditions as well that I think people need to be mindful of.
Well said, well said. Thank you for all that information. And I would like to turn now, Dave, to your associate from the Oakland County Health Department, Dr. Faust. And I'd like him to talk a little bit about the science of the vaccinations. We talked about the efficacy and how quickly we can get shots in people's arms. Let's talk about what this vaccine will protect us from. And what is this 75% herd immunity we have to get to that they talk about? People are saying now that we can see kind of the light at the end of the tunnel. It's going to take us a while to get there. But what is it going to mean when we return to some sort of normalcy, get the kids back in school, and where are we in line to get those things accomplished? Dr. Faust.
Thank you, Dr. Waterman, or should I say Mayor Waterman? How about both?
Well, in the operating room, I use the doctor, but in this circumstances, in this great city of Pontiac, I'll stand for
I appreciate the invitation and the opportunity to chat.
Yes.
I'd like to start out with some good news. You know, we had, back in the spring, we had been seeing somewhere on a 7-day running average, at least 300 cases a day. In November, we were surging again to 800 cases a day, new cases a day. We're well below 100 now per day. We're at 70 or so and trending down. So this is all good news. I want to shout out to my fellow Michiganders for doing such a great job at wearing a mask, distancing, not gathering indoors, because it wouldn't have been done any other way. This isn't from vaccine. This is just from, you know, from the things that we know work, and they're hard to do. It's getting old, right? So let me also start out by saying I have a strong bias for mRNA vaccines. You know, I'm looking forward to a time when our traditional vaccines are transition to mRNA vaccines. They're rapid to produce. They're much less expensive than, say, amplifying virus and viral products in eggs, which is traditionally how we've been doing this. They're much safer than having those egg products in our vaccines. This is definitely the way to go. So I'll just start by saying that. So I'm a PhD in molecular biology before my MD. I'll try not to geek out too much in the science of mRNA vaccines. It'll be tough. If I start to ramble, just stop me. But mRNA vaccines work in this way. They basically take the genomic code of the virus, SARS-CoV-2. They look for the code for proteins that would appear on the surface of the virus, so that if we make an immune response against it, we'll recognize the virus. And they selected the spike protein. And so they take the codon for the spike protein, they wrap that. There's other steps involved here, but essentially they wrap that in a lipid package, say the coating on an M&M, and they inject that as the vaccine. Once in your arm, your cells take that up, and the mRNA is used like our mRNA is used to make new protein. So our cell's machinery reel off copies of spike protein and spit that out. Our immune systems recognize that as abnormal, as foreign, and mount an immune response. So I'm glad you haven't had any adverse symptoms, but I don't want folks to leave thinking that this is no big deal. I want them to know that symptoms are common with these vaccines. So 2 sets of symptoms, basically. One is a local reaction that is redness, swelling, discomfort. maybe the day or two after you get the vaccine, feels like you got punched in the arm. And then, and that's not too unlike other vaccines. And then there's the potential for systemic type symptoms, that is your immune response reacting to that foreign spike protein. And those things are basically 5 things. Those are headache, fever, fatigue, muscle aches, joint aches. Basically, it's a little mini version of the flu. And from my take on this, I would much rather have the entire list of adverse effects or symptoms from the vaccine than getting COVID-19 infection. And none of this lasts. These things always last 48 hours or less. And as we know now, COVID-19 infection symptoms, effects, even once you're recovered, can have long-lasting effects, the so-called long haulers, or these multi-system effects that can linger on and on. So both the Pfizer and the Moderna vaccines have a very similar efficacy or similar success in terms of fighting off COVID-19 infection. I'm not sure why, but occasionally we'll see folks in one of our vaccine clinics who come to us with a very strong emotional attachment to one or other of the vaccines. I just want to encourage folks that regardless of what vaccine they're offered, whether it's one of these, Pfizer, Moderna, or the Johnson & Johnson, or the AstraZeneca, or whatever else we have coming down the lane, they need to accept it and get vaccinated. The only way we're going to put an end to this pandemic is to get as many people vaccinated as possible. Which sort of brings me around to your question. You mentioned herd immunity. I really hate that term. We're not cows. Let's call it community immunity. Okay. So, every virus has a, boy, I hate to do this. Every virus has an R naught. That is the number of people that an infected person will in turn infect. That number is going to determine basically how rapidly it spreads through a community. But in addition, the number of people you need to get vaccinated will reflect that number. So basically, how infectious or contagious a virus is, there will be a balance between the number of people that have to have immunity in your community, whether it's from the so-called natural infection or from vaccine, and how contagious the virus is. So right now, CDC estimates, I won't even do that. MDHHS and CDC both have a goal of 70% of our communities being vaccinated. That's a great goal. I think we should get 100% vaccinated, but 70% will help put an end to this pandemic. Less than that, it may linger longer. The concern is potential variants that are more contagious, that are transmitted more easily. And those variants and how easily they're transmitted will determine how soon we get to the end of this pandemic. And that brings me to this point, and I need to emphasize this. No matter how many variants, no matter how contagious, no matter how easily transmitted, masks work. Mask, distance. Those things, we already know they work. Michiganders have been great at this. We've toned down these surges with masks and distance and not gathering indoors. We can do this regardless of how many variants arrive here in the US. We know we have variants here in the state. We have variants here in this area. I'm sure they're in the county, but masks and distance continue to work.
Okay.
While we wait to get people vaccinated.
The science is very interesting on that. Let me address some of the questions as people who understand the science. but obviously we haven't reached that 70% of the population that's been vaccinated. So I get parents who ask me, well, they're telling me to send my kids back to school. And likewise, we've had our youth center, which has been very limited in terms of the number of children we have there, but it's a service for our essential workers who can't take off. And so we've been able to provide youth activities for our children. But there are parents who are saying, how is it now safe for my children to go back to school? And we see some other communities are struggling with this. And it seems to be also the teachers need to be vaccinated as well. So talk about that from the safety and the efficacy of that from both sides. Both the parents are concerned about their children, both the teachers who are going to go back and to this classroom.
Yeah, I'd be happy to. You know, just like Michiganders have done a phenomenal job, I want to give a shout out to our teachers and our superintendents that have done just a spectacular job at distancing when kids are face-to-face, person-to-person, in-person classroom, and distancing and masking. They really just a spectacular job. While schools were still in session, we had 0 ongoing transmission and outbreaks in classrooms. Now, I'm not going to throw anybody under the bus. I'm just going to say that athletic activities were a different story. That is, all of the school-associated outbreaks we had were associated with athletic activities. Kids sitting on the bench, shoulder to shoulder with no masks, in the bus to and from events with no masks, after event parties with no masks, quite a few outbreaks like that. But the schools, the classrooms themselves have actually been, in my estimation, about the safest place you could be in the community. So the classrooms have been incredibly safe. That is, I could speculate on why that is, I'm not sure, but certainly we know that children have a lower risk of being infected. They have a lower probability of transmitting to others. So we have the science for that. With regard to the teachers, they're on the vaccination kind of priority list. And so we've been, oh gosh, I wish I had the numbers for you today, but we've been vaccinating teachers. So, you know, we're kind of moving through those. I know certainly any teacher that wants to be vaccinated by next September should be able to be vaccinated, but we should be getting through the population of teachers long before then.
I just want to, can I just jump in there? Because
Please.
I have some more recent and more optimistic numbers. We have vaccinated 75% or made appointments for 75% of the teachers in Oakland County who have gone onto our website. And our goal is to have every teacher or school personnel that wants to be vaccinated by the first week of March vaccinated. That's what I meant by we prioritize teachers, because the governor's hope is that schools will go back in person in March. And so we're at 75% now and trying to get to 100% by March 1st, or the first week of March.
That's a great benchmark. Good news.
Thank you for
Good
that.
news. Yes, good. So how about other mass events? You know, how much of the immunity of the population do you have to have before people feel safe for going back to church, for example, or going to football games or stadium games or going to concerts? When is that going to happen? How long do we have to get along this process of vaccinations before people can say that that part of their lives may be restored?
I'll let someone else speculate and predict the future on that.
All right. Good, good. All right. So as we see, the science is not exact in terms of those things, and it depends a lot on how this public health initiative is carried on throughout our community. I think that's as good an answer as any, is saying there's no definite amount. We're kind of unknown territory right now in many instances, and medical science is still gathering statistics for that. So that is good. Thank you, Dr. Faust, for your explanations of these things. One other question I have related to the vaccine often, and people want to know why can't they take the vaccine to their local sites, to their high-rise apartments, or we have shut-ins that I'm concerned about. There's 250 shut-ins in Pontiac that get their meals delivered that I'm worried about how we're going to get the vaccinations to them. And what I've been told, and you can verify this, is they're waiting for the Johnson & Johnson, which they expect to come out, because right now the two vaccines that are available, Pfizer and Moderna, require temperature control. And so because of that need for temperature control, they need to do it in places where they can use it in mass settings, as opposed to taking it out where they might lose quantities of it in smaller settings. So I don't know if you or even Dr. Ferdoli wants to weigh in on that, but that's what I've been told, and you may have additional information for the people who've been asking those questions about people who can't get out and access the other sites outside of
It's
their
a great
homes.
question, and that's an important population to get to. I agree. They're certainly a vulnerable population, and they haven't been included. They can't get out to, let's say, Walgreens or CVS or Rite Aid or Meijer or what have you. So they're homebound. So there are two challenges. One, as you mentioned, is the logistical challenge of managing the vaccine. And just until, well, this week, there was a limit on how you could transport vaccine. That is, we were told we couldn't transport vaccine in a vial that had already had doses removed, and we couldn't transport vaccine in syringes. So if we're going out to a single house to vaccinate 1 or 2 people, that became a limitation. So there was that whole logistical aspect in addition to the temperature factor. And then there's also the challenge of arranging for double doses. And so the hope is that the end of this week, FDA and ACIP will be reviewing the Johnson & Johnson vaccine for single dose efficacy. And that will mean we can vaccinate double the number of homebound. So that would be an enormous benefit. So we're working on it. Stay tuned, be patient. It's at the very top of our list right now.
Okay. So in other words, there's a lot of thought that goes into and planning that goes into getting these vaccinations out and getting the most use out of every vial of vaccine that we have, because it's so precious in terms of supply.
We don't waste any. Every single dose gets into an arm.
Right. Okay. Thank you for that, Dr. Faust, and thank you for being here. Next, Shannon Strebick, CEO of St. Joseph Mercy Oakland. I remember we've done a couple of these healthcare, health policy town halls during this pandemic year. And I remember the first one when you were still wondering how you were going to get enough PPE for your staff. Remember those days when we were really desperate, especially in the state of Michigan, about ventilators? Come a long way since then. Our first responders have been huge. We had so many people who volunteered to get meals to our first responders. So tell me where St. Joe is now. You are a leader and certainly a partner in terms of public health, and you've made a commitment to that. So I would like you to make a statement, if you choose to, and tell us where St. Joseph Mercy Oakland is in this pandemic year.
Certainly. So it's so nice to see you, Mayor Waterman, and it's wonderful to be here with Dave and Dr. Faust, and all of you. You know, Dave and Dr. Faust both summarized that we're kind of on a downward trajectory, which is a good thing with this pandemic. We have a very small number of hospitalized patients at St. Joe's that are positive for COVID right now. We've been running, I think, right around 15 or so on any given day. And we were significantly higher in December during the second surge. We had, I don't know, probably 4 or 5 times that many in-house at any given time. We were seeing a lot of activity in the emergency department. So I agree that the holidays seem to bring a bit of a surge, and since then, things are moving in the right direction, and we hope that they continue to move in the right direction. The vaccine, while it is, it's hard because we don't have the quantity that we would like to have to get to folks. I remind people pretty regularly that the fact that we have a vaccine about a year into this pandemic is unbelievable. That typically would take 3 times that long. So the fact that there are vaccines that are safe and approved for use, I think is we are unbelievably lucky to have them available. We are offering the vaccine at St. Joe's Oakland. We're working really closely with the health department. And one of the things that we started to get concerned about was access for our Pontiac community members, particularly members of the community that may not have access to technology, may not have the ability to get online and get on a waiting list, et cetera. So David's probably going to talk a bit about this. I won't talk too long about it, but we've intentionally started reaching out with our faith community nurses to some of our parishes in Pontiac. And we're directly scheduling parishioners that indicate that they're interested in receiving the vaccine. And I think we've identified around 500 people thus far that are registered to get vaccinated at St. Joe's Oakland. And again, we're partnering with the health department so that we're all leveraging what we have available to help the community, but particularly those that are senior in age and people that live in the community immediately around the hospital is where we're prioritizing right now. And so far the experience, I think, has been very, very positive. We also set up a social care hotline for members of the community to call if they need access to things like food or shelter or mental health resources that Dave mentioned. And I'm going to rattle a phone number off, and maybe we can post this on the Facebook site. It's 833-247-1258. And if people hit number 3 as the option when they call that number, they'll be connected with a community health worker that can help answer questions, provide access to resources, et cetera. So that's another thing that we've set up, because we know it's been a very long year for people. And we still have folks that need access to basic stuff in the community, and we want to make sure that we're still here to support them.
Much in that number. This is being recorded. This town hall we're having right now, there's a lot of people here. It's also going out by Facebook. So for those of you who want to pass this along or to have others avail themselves of this expertise we've had here, you can check out the city Facebook as well as the mayor's Facebook, as well as our Pontiac Connect. We now have our own resident app kind of executive called Pontiac Connect with 1 C in the middle. And we put all these kinds of social media alerts on that app as well. So there's many different ways, as well as we rebroadcast on our government channel, on our cable channel. So this information will be available for a time to come for anybody who's missed it today or wants to repeat it. As you've given out the number for St. Joe, that direct line for vaccination scheduling, I also want to give out a helpline number we have in the city of Pontiac, and that's 248-758-3300 for those who have trouble navigating the systems. And I know there are a number of different systems and people are confused about whether their spot is held with another one. Our senior specialists are trained and they're actually taking down numbers. And we do have a special hotline with the next person I'm going to talk to, Dave Bowman, who we are giving you the numbers so they can get directly on your list, and that you're all calling seniors to make sure that they have in place in line on your system as well. So with that, Dave Bowman, I would like you to speak to that in terms of augmenting what Shannon Strebick just told the population over here for this town hall.
All right, perfect. And again, thank you, Mayor Waterman, for the invitation to the session and allowing us to support the community outreach related to vaccination. We've got a little bit of feedback.
Wear one safety can for just $29.99 and get a second.
All right, perfect. And so again, I did want to provide a little more clarity relative to the direct dial number that was provided. Again, that 833 number will route you directly to a member of our community health worker team to record your information and receive that direct COVID registration opportunity. And again, we are supporting our senior community as well as vulnerable members within the Pontiac service area as well. And we currently are utilizing three processes to support outreach and registration for community members. The most successful and the most accessible being that direct registration process using that 833 number. But we also have an open scheduling process in addition to ticket scheduling for our direct patient volume as well. And each of those services are indicative upon vaccine availability. As Dave Coulter, our county executive, had noted, everyone within the community ultimately will receive a vaccination. And based upon the Michigan Department of Health and Human Services phased vaccine approach, we are continuing to support that 1A as well as that 1B category. But again, with that specific focus within Pontiac. I also want to make mention of the direct relationship with our faith community nursing churches and program. Currently, we are focused on three churches within the community: Trinity Missionary Baptist Church, Welcome Missionary Baptist Church, as well as Newman African Methodist Episcopal Church. And we have faith community nurses embedded directly within those ministries, not only to serve as registration support for the congregation, but the community at large as well. In the weeks ahead, we will be identifying additional community churches that we hold covenants with to provide that health education as well as that direct registration process. But in the interim, I solicit that 833 number for community members, specifically seniors, that have interest and or need to receive their vaccination. And again, that direct call process, we've noted that as a unique way and opportunity to circumvent some of those barriers to care, specifically technology and or maybe transportation. And again, that direct registration process allows us to call, reach out, and provide that access to those that may be in need.
Thank you, David. Thank you. And so we do have the numbers in the chat for both the city hotline as well as the direct line for St. Joe registration. And once again, we just want to sort out the process. You're starting with the church, the faith-based community. We did send out this information to the pastors. We have about 140 churches in Pontiac. And so we want to make sure that each one of them has access to get their parishioners' questions answered. And so that's why this is helpful as well as what we're doing with the senior specialists and the other administration staff who are answering those calls and giving that information, helping people get into the various registration sites. Then I would like to turn to another colleague, Dr. Fragoli. County Executive, I know you have to leave soon. If you do have to leave, I just want to have you give a shout out to you and thank you for coming and for being here and for continuing to get this healthcare crisis handled in such an efficient way in the city of Pontiac, telling people to be patient. You're working to get shots in arms, and I thank you for being here. And we have a number of these different initiatives. We're going to talk about the Phoenix Center tomorrow and the great way that that's going to close and be a great transformational project for the city of Pontiac. So we have much to talk about.
Thanks, Mayor. Great to be with you as always, and your distinguished group of folks here. It's happy to see all of you, and stay safe, Pontiac.
Stay safe. Okay. Dr. Fragoli, how are my colleagues doing over there? I know you're on the front line, saving lives. What has this experience been, and where are you now that we've gotten to this stage and this pandemic coverage?
Thank you, Mayor Waterman, and thank you to our city, to our county, and to our state. We have this has been a journey. It has been a challenge, and we could not have done it without our first responders, our nurses, our doctors, our therapists, our housekeepers. Everybody is a link in this chain that during this pandemic has been absolutely a critical part of us being successful. And, you know, we're here for our community, we're here for our patients, and have had very strong, resilient physicians and nurses at the height of this pandemic, break apart and fall apart and start crying because they knew that they had to be there for their patients. And it's heart-wrenching, but I've got to say that this is, that was about a year ago. It felt like it was maybe 10 years ago, but it was a lot has changed in these 12 months. One, we know much more about the science of this new virus, this new disease. We have new treatments that are available, and of the greatest glimmer of hope is the vaccine. And now it's just a matter of getting as many people immunized with, as you said, shot in the arm to get everyone protected, especially those that are most vulnerable. And many of those are in the city of Pontiac, our elderly, those that are frontline. We've got to get them access to a vaccine as soon as possible. And I will say that, during the early part of the pandemic, there was a lot of fear. Our own clinicians, our own employees and colleagues were really struggled with just the fear of their own safety and worried that they take this vaccine back to their families. But with the vaccine, the disease back to their families. But with this vaccine, I will say that we are in a much better place. There's a certain confidence in taking care of our patients. Although now as Shannon mentioned, we're down to, I think, about 16 patients in our entire hospital, which is great. But there was also a fear for patients and families about, is it safe to come to the hospital? And this was something that we saw patients sort of taking, certain preventative measures that they normally would have their checkups or their mammograms or whatever it is, and put it on take it to the back seat and hold off because they were afraid that they would get sick coming into the hospital. And I will tell you that we spent countless hours and days and weeks planning for keeping our hospital environment safe, from cleaning protocols to testing. So patients that have to have an invasive procedure like a surgery or some other procedure, we have testing before to make sure that all of our patients that come into the hospital have been tested and that we're certain that they won't spread it to other patients. And so there's a certain amount of comfort that can be taken for all. And this is a message to all of our patients and families who are listening, is that the hospitals are safe. The doctor's offices are safe. Your dentist's offices are safe. And it's important to get that preventative care so that something that you can prevent doesn't become a much larger problem with it being delayed. And so I think this is very important for us to make sure that our wellness is maintained, not only physical, but also emotional wellness. And so it's important for us to make certain that we keep that at the top of mind. As far as vaccines are concerned, it's been a wonderful journey. We're not professionals in mass vaccination, but I will tell you that we've gotten pretty good at it. We've given about over 12,000 vaccines since December, shots in arms. And it's by appointment. It's on campus, so it's very convenient for our patients to have access to us. We run the clinic 8 hours a day and 6 days a week. And we have the capacity of 600 vaccines per day, which is great. It's just the rate limiting step is the availability of vaccine. But we found a great partner with the health department. The Oakland County Health Department has been absolutely wonderful in helping us sort of take this challenge on together. And so I'd like to thank you for inviting us. And I wish the best for our entire community.
Okay. You've been a wonderful panel, and we have feel like we've survived together with all the input of the medical community, certainly of our partners there, both at St. Joseph Mercy Hospital and the Oakland County Health Department, as well as all the administrators who've been part of putting a plan together that is for the public health benefit of our communities. We know that we are a vulnerable community, and so bringing a vaccination site here was very critical to reducing some of those barriers. But we're hearing here from all the information that you've given out, which I hope is useful information for many people who've had a lot of questions about what happens next, when their turn comes up, how they get registered, the efficacy of the vaccine, and what this means to our future normalcy someday down the road here. Thank you for all the information you put out. I know there are probably other questions. Please feel free to reach us at any of the numbers that we gave out for those of you who have attended. Pass this information along. And for those who were sitting on the sidelines trying to wonder whether or not you should take the vaccination or whether it was safe to go back to work or safe to send your children back to school, we hope you've gotten some real information out of this, and knowing that we're marching forward now to the light at the end of the tunnel, when we can go back to real life, and COVID-19 will be something that we have tackled again through all the help of our first responders, scientists, administrators, and all those who've been part of dealing with this public health crisis. I'm proud to know you. Thank you for coming. We will meet again. We'll continue to partner on other adventures, and be well, be safe. Thank you for coming, and thank you for all who have attended.
Thank you.
Thank you.